Boy. All right. Hi, everybody. I'm trying to stream this via Facebook at the same time, so I haven't done this before by myself, so we're going to give that a shot in a few minutes. Welcome, Kathy.
David.
All right. Just getting the stream set up. There we go. We'll do it from mine. Okay. So why don't we get started? We've got expecting a few more to join us, but we'll get started. This is being recorded, so we'll post this on our Chamber YouTube page and Chamber Facebook page later as well. So I'd like to welcome those in attendance today. And one of the things that we're learning quickly as we adopted the Chamber is that, yeah, however many you have live doesn't necessarily mean however many are going to view this content over the course of the next probably week or so, because as we've, I think, collectively been experiencing, the information and the data and the environment and the context is changing sometimes on a daily basis. So I'm just really pleased and happy that we were able to have able to arrange this on a short notice with the Brant County Health Unit to really talk about what the levels, the response levels mean in our community and what that means for business in particular. And did give the health unit, and Jerry can do an introduction of himself in a moment. Just give him a heads up on a few questions that we've heard from business, but even more importantly, able to take questions from those that are viewing it, and to just help us collectively understand what the various response levels mean, how do you change that moving forward, or what makes those changes moving forward, how quickly they change, and what businesses can do to respond, as well as really an open question answer period as far as PPE questions, operating for business, and really what's a safe experience moving forward. So without me talking any further, I'd turn it over to Jerry to lead away. Thanks, Jerry.
Thanks, David, and thanks to the Chamber for the opportunity to help you out today. I thought what I'd do is
still got you on mute, Jerry. Are you still on mute?
I can hear you. Can you hear me?
Still no audio, no. We did test this out earlier, and the audio was working.
Yeah, I can hear whoever is speaking now.
Yeah, I can hear you, Jerry.
Okay. Everybody else hear me? I see some nods. Kathy can hear me. Winona can hear me. Okay. Okay. Well, my name is Jerry Moniz. I'm a program manager. I manage chronic disease, injury prevention, harm reduction, and schools programs at the Brant County Health Unit. Right now, I'm doing a lot of COVID response, just like most of our team, and part of that is enforcement, and part of that is helping our case managers. So I thought today I would go through the response framework a little bit, like high level, sort of where it came from, where it's going. There's a lot of specifics in the colors themselves, so I'll probably be able to touch on those when I answer questions. So if everybody's good with that, I'll just go through a brief overview of the framework and then answer questions, especially around how they impact your businesses. So the framework was implemented November 3rd. And the reason for the implementation was that there was a need to respond to increasing cases, and what the provincial government was hoping to do was to do that without going into a full lockdown. So they implemented the 5-color system. The green protect, the yellow or prevent, yellow was the protect, orange is the restrict, red control, and then gray is the actual shutdown. So that's back to a full lockdown. Those were the color systems they put in place. And again, the idea was not to go from a level to a complete shutdown, but go to a graded system depending on numbers and depending on regions. So that the public health could and the government could respond regionally and not going fully to a lockdown, I guess is the reason they came up with the color system. The way the system works is that once you go to a system, it's based on data, first of all. So you move through the progression of colors based on the incidents in your community and also the availability of hospital beds, the number of outbreaks that are happening in your community is also one of the ways they measure the reason to move, and the incident rate within your community. So all of those things are taken into consideration and to move from one color to the next. Once you're in a color, so orange, for example, that Brant is in right now, we're in that color for 28 days, unless there's a major spike or one of those other numbers or incidents come up, then we will move up. If we stay the same and the data doesn't change, then we will remain in that color scheme of orange for 28 days. That's basically very high level what the system looks like. David, I didn't know if you wanted me to take some of the questions that you had sent to me, or
yeah, I think you can start.
Yeah,
you can start with questions from the floor, I guess, and then you can roll into some of the questions I sent you if it slows down.
Okay, yeah, I've got a bunch here. Okay.
So, any questions from the audience? I think you can just pipe in if you want. Or put up your hands. Or Jerry, you can take the first one away.
Yeah, I can just go with some of the questions that were asked. That there was a lot of questions about the screening of employees versus screening of the public. So
Yeah, I found that that's been a comment on our end.
Yeah, so if you are a business owner and the public is invited into your facility, there is a screening that is expected, and it's a passive screening. So it would be a document on your wall that has 4 or 5 questions, and we can supply those for you if you don't have them. Basically asking members of the public if they have any of the following conditions. So if they have a cough or any flu-like symptoms, if they have loss of taste or smell, those sort of things. That's one question. Another question is if they've been in close contact with a positive case or if they've traveled. Those are just things that you post. So people should be directed to look at that. And if they say yes to any of those things, they shouldn't be coming into your facility. So that one's pretty basic for the public.
Now, does that change as you move through, as a region moves through the levels?
No. So the screening process, both for staff and for the public, stays the same.
It starts at green.
Yeah.
It starts with the green level. Okay.
Yeah, and we can we have those documents. We can share them with the chamber if you wanted to get them out, and people can just post them and be directed to them.
Okay. And I think we've shared some of all the stuff, just a scan that I did yesterday and today between many of the partners on the call right now with City of Brantford and County of Brant. I've shared those resources either on their webpage or through their newsletters, as well as the chamber most recently as well. Yeah, I mean, I guess I'll send it to the next question of the ones I've sent you, and then certainly if anybody, I'll watch for hands in the air, hands on the screen if you want, if you've got something that you want to ask for. So, Jared?
Yeah, so for staff, so now with the color system, all workplaces are expected to participate in a safety plan. And again, those safety plans, templates for those plans are available on ministry websites, or we can, again, get those to you. And what the plan goes through, one of the things it goes through is screening staff. So that screening for staff can't be a passive screening, like we just mentioned. It's a more active screening where there's a piece of paper, or at our workplace, we do it online. There's different tools online and apps that you can use, asking the same questions again. You know, symptoms, have you been in close contact with somebody who's a positive? Have you traveled? And again, yes to any of those questions, an employee could not be coming to work.
Does that apply, that screening process applies to all levels of business and all types of business?
Yeah, that goes from mom and pop businesses to the biggest businesses. So all workplaces are expected to screen their employees in some way, shape, or form. And you can decide how you do that. It's actually an occupational health and safety requirement. Okay. So it falls with the occupational health and safety. You're expected to be able to produce it. So you don't have to, like the safety plan, I should say. The safety plan comes under the occupational health and safety. So workplaces have to have a safety plan, and as part of that safety plan, there is screening that has to be done.
And the tracking of employee responses on a daily basis, like how is that supposed to be recorded? It's got to be recorded electronically on paper, and then how long do you keep that for? Is there a prescribed format? What does that look like?
The format is up to you. So you can do it in paper, you can do it on your computer, you can do it by an app. It just has to be done. It has to be kept for 30 days.
And actually, I'll do a shameless or not so shameless plug. The chamber just partnered with an app, web-based tool called Get Ready that does that confirmation on a day-to-day basis. So I think we just sent that through in our newsletter yesterday. But I think as you noted, there's several different either websites or apps that you can use that businesses of all types can use. I think the Get Ready one is the Brant County Community Healthcare System uses it, or used some of their technology in terms of their infection and prevention control process as well.
And the other parts of that safety plan, so one is screening of people. The other part of the safety plan includes is how you're going to deal with somebody who becomes positive or becomes ill at work. So how can you isolate somebody at work? So they come to work, they feel fine. middle of the day they get a runny nose and they're feeling very ill. Is there a place that you can isolate people? What's the process for then getting them to an area away from other employees? That's another part of the safety plan, as well as cleaning processes, a few other things that are in that safety plan. So again, we have that template. We can send it to you via David through the chamber. It's on the ministry website as well.
Any questions to follow up with Jerry on that one? All right, we'll send you to the next question then. Pre-populated question then, Jerry.
Yeah, one of them was, yeah, there was a question about all workplaces. The safety plan does apply to all workplaces. One of the other questions was differences between manufacturing and warehousing. So there really is no fundamental difference between those two workplaces. So they still would have to have a safety plan, and everything else would apply that we've chatted about. The other question was, do you have to ask the screening question every day? And you do. So you have to ask every employee every day in whatever format that you want to come up with. And it really just takes a minute. It's 4 or 5 questions, then you're done. There's a few other questions, but I think they were covered there about the 28 days and how we move between colors. I think I covered that off.
I sent through a few questions earlier this afternoon or later this morning around the personal services industry.
Right.
Do you want to potentially take care of those?
Yeah, I don't have those in front of me. I think it was about air exchange. Is that correct?
Yeah, I know in a couple of, I think particularly from the fitness industry, one of their points around or points towards the discussion in terms of being able to stay open, those types of things, is that they have such a high rate by design of most of their facilities. They have such a high rate of exchange of air on whether it's an hourly basis or a daily basis. I guess, is that type of data in terms of the existing HVAC types of systems that are doing air exchanges, is that being considered by those that are making the overall recommendations? And then, so subsequently then, in terms of smaller venues, whether it's office-based or home-based personal care settings, are there standards in place to allow for safe openings or safe operations with a particular set of air exchange principles?
In our documentation that we have and that we followed since the outbreak started, really air exchange has not been an issue for most businesses. The exception would be dental offices. So when dental offices were reopening, that was a big part of how they were to be reopening, was having a good air exchange because of aerosols present in the air. For most businesses, that is not an issue and isn't considered, to be honest with you.
Not an issue.
Hey, Jerry, this is Rob.
Hey, Rob.
Hi. Sorry, I couldn't. I had technical difficulties with my Wi-Fi, so I just thought I would call in.
Thanks, Rob. You want to jump in on that? Yeah.
Yeah, my name is Robert Hall. Yeah, I'm the manager of environmental health and for the public health department. And one of the things that, on the question of air quality, one of the things that professional businesses can do is talk with their colleges. This is those places like dental offices or chiropractors or those that have a professional designation. Their colleges are working on them, working with them to develop standards for what they could use inside of their professional buildings as more of an occupational health and safety measure, as opposed to protecting the public coming in. The ministry does say that the best way to protect the public is by using the standards that are in place through the regulations. With the PPE for those that need it, the use of masks and the use of the 2-meter separation at all times. So I just wanted to let you know that those are some of the things that are happening, but Health Canada is saying, they're the ones that do the authorization on the types of masks. I know that was another question that you had sent, David.
Yeah.
And one of the things that people can do is if they have questions about the types of masks that they can use, they can go to the Health Canada website because it tells you which ones are approved for personal protection, which is that PPE, which is a little bit different than the cloth masks that we ask people to wear for source protection. So those are two different types of protection measures. One is protecting the person itself, the PPE. You're protecting yourself from exposure by wearing a medical mask or a surgical mask and face shield. But the cloth mask is really used as a means to protect other people from your exposure. So they're two different frameworks for why you wear different types of masks. And Health Canada has a list of approved health face masks. There was a question about those stick-on ones. And the stick-on ones are okay for people to wear as long as they're sealed properly, but not for staff. Staff in any workplaces who are working with customers should wear the proper PPE.
Okay.
Thanks, Rob.
Yeah, I thought I would just chime in because part of what we do with the infectious disease team is look at these types of things. Now, I know that Public Health Ontario, PIDAC, which is an organization that through Public Health Ontario and the Ministry of Health, does a lot of work on trying to develop standards that will help with infection control in different settings. But one of the major areas for looking for research, if you're interested in developing or looking at your air quality within your own businesses, is the CSA standards that are required. And I will be quiet for a while.
Okay. A question in the chat. Is the requirement the same for employee screening if the business does not usually have customers?
For employees?
Yeah, I guess that I almost apply to the chamber office as well. Like we have, I mean, using us as an example, I think building off this question, like there's typically no more than 3 of us in the office, and really our only visitors are the mail guy accepting packages. So I mean, we've been doing asking the questions every morning with the 5 or 6 questions on the sheet. But is that the same? Is that requirement to do that the same, say in an office environment where you don't see clients or customers versus a more active environment where you're seeing members of the public on a regular basis?
The expectation is that all workplaces do a workplace screening for their employees. So
Okay.
regardless of whether the public's in, yeah.
Okay. And then you keep the answers on record for a 30-day period.
Yeah.
Okay. Are there any other questions from the audience? Either I haven't checked any of the Facebook side of things, but it looks like we're okay there from the audience viewing through Zoom. Yes, sort of going once, going twice, but I'll throw it out there if anyone has anything to ask to Jerry or Robert. Or Jerry, anything you'd like to add to sort of prompt this along?
Sure. The questions might come later, as you're thinking later on in the day or week. Certainly Rob and I are both available and Public Health's available to help the Chamber and Chamber members with any questions or support they have in terms of answering direct questions or getting you resources. We've done that throughout the pandemic and are happy to continue to do that.
Okay.
Especially restaurants, gyms, there's a lot of questions. Things change very, very quickly. Frameworks are put out, regulations are put out and then changed almost daily. So
yeah,
and you probably already know that it can be very frustrating for people. It's frustrating for us, quite frankly. But we can work together with you guys to get where you need to be.
Sounds good. Yeah, we don't. I mean, we were doing these pretty on almost a weekly, if not twice a week basis through most of April, and then really slowed that down. And now it's been now with the pace of, I mean, we're back to even accelerating or being past what our numbers are like in terms of infections in Ontario. And I guess that's maybe a question as well. Is part of the increase in numbers is it related to the increased ability to test and report? Is that one of the potential causes for having a higher level of incidence in both the province and in the region?
It could be. We haven't substantially started testing a lot more. The numbers are going up because there's more people with COVID, quite frankly. And the projections are for it to get worse before it gets better. So that's why the colors, moving up the color system is trying to get a handle on that before we have to go to a full shutdown.
Yeah. Anything further from our group? I've been actually on these calls in various formats all day, so I'm looking forward to not staring in front of a screen. But certainly would like if there's any questions out there to ask them, but also very much willing to wrap it up and see you on your way and hopefully enjoy the sunshine for the next couple hours or so.
Yeah. If there's questions that, even through you, David, if you want to shoot us like questions like you did, if that's easier format, you can shoot it to Rob and I. We can answer them, get them back to you. Whatever format works for you guys, we're here to help you out.
Absolutely. Sounds good. So we'll do that. I direct the audience either here or watching this later that the Chamber does have a partnership with the Get Ready app that would allow for a quick employee screening at a very low cost and open to businesses and services of all sizes. From a Chamber's perspective, look forward to a couple of events coming up in the next couple of weeks as far as getting out and shopping local in a safe manner. We have a 12 Days Christmas event as well as a shopping holiday blitz, and certainly look to support where we can. And I know it's a challenge, but I think right now we're able to do things in a safe manner with PPE, and hopefully we can avoid a full shutdown like we experienced in the spring. So thank you, everybody. We'll wrap it up for today, and as things change, we may do another one of these with the health unit and maybe some other partners if needed. So thanks again to Robert and Jerry for your time today, and for everybody for participating. Stay safe, test negative, and stay positive. Thanks, everybody.
I like it. Thanks, David.
Bye.
Bye.
Bye.